Welcome, everyone, to the Lion Hearted Podcast, where courage meets purpose, and every conversation is an opportunity to inspire and ignite the heart within you. I'm Dr. Steve Rasner, your host, and today I have yet another incredible guest that I'm so excited to be. Actually, he's my second big-time guest. The first, by the way, Sonny, was Mike Picos. So you're in good company, my man. I want to say a couple things first. I told you guys for the last 6 months that I was going to go to a bigger format. You know, I wanted to share with you clinicians that inspired my clinical journey. And I have many more coming for you. In fact, Bill Strupp is coming up in a couple weeks. But I not only was influenced by clinicians, I've met friends along the way. The one I'm about to have as a guest, to be total disclosure, I haven't known him that long. I don't know how that's possible. Most of you do know him. He is the head of the podcast, the Fee for Service podcast, and his name is Dr. Sonny Spera. Say hi, Sonny.
Hello, how you doing, my friend?
What's really ironic about this is I did Sonny's podcast as a guest
several times.
Yes, I did. Well, we may have to do more than one with you. And
I'm rolling.
Here's the truth. I was attracted to do your podcast because the name of the podcast resonates with what my clinical career has been. Or my business career has been, as in a fee for service practice for the last 15 years. It wasn't always, guys, by the way. Right. I'm sure Sonny paid dues and I paid dues. It's really hard to come right out of dental school and open up a practice and just be fee for service, because when you're fee for service, I don't feel funny saying this, you have to earn it. People have to be willing to go out of network and, in essence, pay more out of their pocket to go to you, and you have to make it worth it. Not just you, but your entire organization. So when I found out that Sonny not only did that, but had an entire podcast dedicated to it, you're darn right I wanted to be a part of it. And I certainly wanted him on as soon as I could get him on. So I just had a new patient. This new patient was referred to me. She was a 47-year-old female because she was scared. And her last office did not want to deal with that. And the training goes into it. You got to have an oral sedation permit, etc. And before I got in the room, Michelle had done the one-to-one interview, which is part of my protocol. Because sometimes when you're in a one-to-one interview, you find out things that you didn't know over the telephone interview when they first called you. So Michelle comes to me and says, after she did the in-office one-on-one interview, she said, listen, they're almost uncomfortable about it. Money is really tight. They had a house fire last year, and, it took a big bite out of their budget unexpectedly. Their house was totaled. So this was my last patient before this podcast. And I want you to know the outcome of this. Like, I went in deliberately hoping that this would be a minimal nothing treatment plan. Now, how would that be? Well, she wouldn't have a lot of restorative needs, maybe be one crown. I didn't know. And I couldn't influence. And I did my whole thing that many of you are familiar with, that I've done so many times by case presentation. So I go in, and this is what I find. She has her chief complaint was some sensitivity on the upper left, and she didn't love her front teeth. All of her front teeth, 6 through 11, had 5 to 6 surface composites on them that had stained, and she didn't like the color. And they had caries on it on top of it. So now I'm in a bind, because if they didn't have caries, I would have been fine just getting back to that. And she really wanted to do something about it. So now I'm locked into absolutely full coverage restorations, crowns, and maybe even one endo. By the way, she had a history of 5 root canals already in her mouth. Decimperio, needed scaling root planing, but did not have bone loss, but definitely her tissue was in need of therapy. She had 1 missing tooth, so this wasn't devastating. She did have some signs of erosion, and it wasn't clear to me yet whether that was from gastric reflux or a diet. Anyway, here's my point. I really wanted to give her a simple, easy treatment plan, but I couldn't. And by the way, she also said to me things like during the interview, she said, I said, what happened to the 1 missing tooth that you have gone, you know? And she said, well, I went in to do an endo and they could not get me numb. The endodontist could not get her numb. And, you know, she was pretty petrified in relaying this story to me. So I've got my hands full with this patient. And she asked me after Michelle presented the treatment plan, which was, I don't know, was at least 7 full coverage restorations because 2 of her teeth had endo. They were falling apart, large restorations, and had no final restoration on them. I didn't know how to make it any less than 7. It might have even been 8 full coverage restorations. And she came back, and as Michelle did, she came back to me and said, is there anything else you can do? This is Michelle, my coach, talking to me. And I said, if I was her, either get another opinion somewhere else, but this is what I'm going to stand on. And this is why I'm telling you this story. And I know, Sonny, you can relate to it. I think 25 years ago, I would have done really large composites on her to try to satisfy the budget that she had. And I am definitely sensitive that she had unexpected debt last year and her budget's hit. But that will, anytime you double back to make it less because you feel, I get feeling sorry for a patient, but they're going to own you and you're going to own that case. And that case is just, those teeth are too large to restore again with direct composites. I mean, I don't feel one iota of giving her the advice I gave her. I said, think it over. Make sure there's no way you can do that. Because if you do it with me, that's how I'm going to do it. By the way, she didn't like her smile either, if I haven't said that already. So sometimes you don't do the case. And when you're in a fee-for-service practice, the onus on you to perform and have happy patients is even higher. That's it. So let me get on to my guest. And I'm so excited. Sonny Spera graduated high school back in 1981. I was already a dentist. Thank you. Here's one really cool part about him that I knew early on. And I don't know about you guys, but I know to play Division I, any sport is a major thing. Sonny played basketball on a scholarship to Syracuse University. Do you look back at that now, you know, many years later and appreciate it more now? Or what is that like to you? I know the podcast isn't going to be about your basketball career, but I'm just interested.
Yeah, I look back on it more fondly because at the time I didn't appreciate it. And especially like my junior and senior year, obviously Pearl Washington arrived on campus, so my playing time was shrunk to almost nil. So when that happens, you know, it's unfortunately it's linked to your happiness. You know, you don't think you're getting the results you want. So, and you're a proud, confident young man, and it shakes you. So I didn't handle it great. And I look back now, I should have really appreciated the fact that I was a teammate of Pearl's and was able to experience the many things we did, which I do appreciate, but I just wish I had a little bit better perspective.
Did any of the people that you played against or on your team go pro?
Oh, yeah.
Really?
Oh, yeah. Ronnie Cycli, Raphael Addison, Pearl went pro.
Yeah.
Before that, did Tony? Leo
Oh,
Routens was a
Leo
first
Routen
round
played
draft
for the
pick of the
Philadelphia 76ers. I know that for a fact.
76ers first round
Yeah.
pick. Yep. So those guys, yeah.
Wow. Well, I don't know. If you're looking at me and you're watching this podcast this week, you're seeing a broad smile because I know what dedication and commitment it takes to be a D1 athlete. So pretty cool. So then he goes on and goes to graduates at Sonny in Buffalo in 1989, did great, top of his class. And he opens up a private practice in 1989. And since that time, you know, he's a member of a lot of societies, and I'm not going to mention them all, but all the from the ADA to New York, of course, to the International Association of Orthodontics. He resides. Where do you reside? I don't even know where you live.
It's Enwell, New York. It's right by Binghamton.
By Binghamton, New York. Here's what I.
Oh man, that was butchered. You butchered.
Say it again. What is it?
Binghamton.
Yeah. I'm from Cumberland County, New Jersey, right?
You can stop.
You kind of talk funny down here. But so here's the deal. He was an associate for 2 years. He bought a small practice. Mm-hmm. Now, he's not in New York City, folks. He's in, how far is Binghamton from Manhattan? 2 hours?
2 hours. 2 hours, 45
What's the
minutes?
biggest city near you? Because they're going to think, oh, he's from New York. That's why he can do what he does.
Well, I mean, the biggest city, Syracuse is an hour and 10 minutes. Scranton,
but that's a college town, right? Yeah, big one.
Yeah.
So after he did that, he grew his practice to 4 more locations. So now you have 5?
Now we have 5, yes, sir.
And approximately 60 to 70 team members, somewhere in that neighborhood?
In that neighborhood, that sounds right.
You are fee for service in all of those?
Yes.
Okay. And the name of your podcast is literally what?
Well, the name of the podcast is the Fee for Service Dentist Podcast.
Okay. So check that out.
The name of the practice is Progressive Dental.
Okay.
And we have Progressive Dental of New York, Progressive Dental of Binghamton, Progressive Dental of Norwich, and Progressive Dental of Montrose, Pennsylvania.
You look at his Facebook page. This guy can say good morning and 200 people, I mean it. Like I could pass away and 150 you would mention it. So, oh, he was a nice guy. Sorry to hear it. This guy says, hey, good morning, everybody. It's a beautiful day. And 300 people will say something or like it. And you know why? Because you're just a good dude. And I've come to know that.
Thanks, man.
And that's part of being successful in life, let alone a fee-for-service practice. And so let's dial back to that for a minute. How long have you been in that genre of a practice? Has he done it for 5 years?
Forever.
Longer?
Forever. Yep. Never known the other side. We've always been out of network with all insurances.
Okay. So you heard what he said. And the reason I'm going to ask Sonny this next question is because I know lots of you that turn into my podcast want to be a fee for service at some point, and you face intrepidation. Like I wasn't always. Sonny just said from the beginning he was fee for service, which is astonishing if you're doing that in the early 90s. I didn't have the cojones to do that. So, I thought, look, I'm from my hometown. I'm doing this podcast right now from my private office. I was born 20 minutes from here. I don't live here, but I was born 20 minutes. I know, and I've been here for 43 years. So everybody knows who I am. And, I was worried. I was worried about all the patients that had Delta Dental or Blue Cross Blue Shield and all that. And then in my area, it was the teachers all had Delta Dental. Mm-hmm. And it seemed like and I was doing really well in the 90s. It seemed like every teacher on the planet came to me, and all the nurses came to me from the hospitals, and they had Blue Cross Blue Shield. And I took the stinking insurance because I was too intrepid of what people would say and the fall off if I didn't. And I also did it for one other reason. Every Monday was a great money day here because all the checks from all the insurance plans arrived on Monday. Well, let's say that check was whatever it was, 10,000, 20,000, doesn't matter. Nobody ever sits down at the end of Monday, do they? And looks, well, what is this makes up this number of this check I just got? And if you do, you would find out that you're getting paid 40, 50, probably not anymore, percent of the actual fee that you charge.
Right.
Right. And so the $20,000 mail day on Monday or whatever it is for you is absolutely delusional. It's not real.
Mm-hmm.
It's really an indictment of why you need to pursue this. You don't have to pursue it like he did, but since you're my guest, how the heck did you do that? Like, I didn't even know anybody was talking about fee for service in 19. What made you say that? Go that direction.
What made me practice that
What
way?
made you say, hey, we're not going to take insurances. We're going to go out of network.
Oh, well, the practice I went into as an associate, that's how they were. And the majority of the other practices in our community were similar.
You mean fee for service?
So most people,
That's beautiful.
most people were, they were non-participating, right? They were not participants. Now there was a push in the right when I got out of dental school in '89 to have a influx of insurance influences, and what they would do is they would go to you in your single solo office in your cave and say, listen, Dr. Rasner, I want you to sign up. Dr. Smith right down the street, he's going to sign up, and you're going to really feel a hurting. And the fear mentality, right? Fear of missing out. I guess everybody, the young guys, right? FOMO. And that's how they did that. But we had a group that we formed outside of the dental society because you couldn't discuss it as a dental society. So we formed a group. I can't remember what we called it. You had to pay dues, and then you could discuss certain things like this where it wasn't colluding. And it really was just informing you. And then they told you about, the least favored nations clause. So most of the docs really didn't get involved. And there were some that took the bait. And then I remember talking to them. I said, why don't you get out of Blue Cross Blue Shield? And exactly what you said. We get that check every 2 weeks, and that's our payroll. So we don't want to give that up. I said, the patient will send you the money. The check goes to the patient. Like, why would you stay? Because once you're in one Blue Cross, you're in every single Blue Cross plan. Yeah. And they didn't want to hear it. And in fact, I took the oral surgeon out to lunch one day. It was practicing literally around the corner from me. And I said, why are you participating in these plans? First of all, there's only 2 other oral surgeons in town where there used to be 5. They can't sit down for a moment because they're booked out months. And you're participating in all these plans. Now, one, I'm not encouraging my patients to ever go see you. Okay? Because you're gonna make it, quote, hey, I'm in network and it's a discount. Why am I not getting that with my other docs? I said, that's number 1. But number 2, you don't need to be. You really do not need to be. You could thrive being out of network. And he just wouldn't do it. So now guess what? He's working for a DSO.
Wow.
Got out of his practice. And we are down to 2 oral surgeons in our area.
So
where we had
to be
5.
clear, you're saying that the insurance companies did come to you. Why?
Oh yeah, they came to all the private practitioners, and then they would come in and give you the fee schedule. And everybody always looked at $2,750, right? What's the code? What are they paying on crowns, right? And I was laughable because some of them came in and that was an inflated reimbursement. But you look at their hygiene, their preventive, or just their basic restorative, and let's say a occlusal amalgam at that time was $100. They were paying $50, $40, $60, and I was like, wait a second, like why would you consider this? And I would I'd have that conversation with the patient, and what I would tell the patient is very simple, very simple. You are coming in and you're seeing me, and in the other room might be the CEO of IBM, and in the next room is a person that maybe sweeps the floors at the school. Guess what? You all, I don't, I don't discriminate against anyone. Everyone has the same fee. So if you get a filling and he gets a filling and she gets a filling, you all pay the same freight, whether you have insurance coverage or not. Because some people thought, well, I have insurance, so you're going to charge me differently. No, you pay the same thing as the person that sweeps the floors. It's only fair. It's absolutely unfair to do it any other way. And people understand that when you explain it that. That's how I explained it early on.
Yeah. Well, I'm talking to you, so I know that you get what I'm about to say. But again, and I know that I've had many podcasts about this subject long before a guy that actually hosts his entire following is about fee-for-service guys that follow him. So the first thing you got to understand, and I'm talking to my people that listen to my podcast right now, is that it's doable. I mean, make yourself a plan. Give yourself a year. If it intimidates you, there's a famous guy out there named Graham Weaver, who is from Stanford Business School, and he's just this philosophical guy, and he's always quoting really interesting people. And one thing I heard him quote was Buddha, and Buddha said, "It always gets worse first." And you got to remember that when you make changes in life. If you make the change and drop an insurance even on the way to drop it, it's intimidating because, they're not going to say, "Hey, you go out there and try, young man, and we'll be there with open arms when you get back." They're going to say the opposite. They're going to say, "We're going to make it really hard for you when you come back. If you take Delta, Delta literally did this to me. When you want us back, right now you're not taking all the plans because I didn't take the crappy plans because I was grandfathered in. I don't remember all the logistics of it. But it said if you leave, you will have to take everything back, the best plans and the bad ones that we offer." And so that kind of stuff's going to happen to you. And even other stuff, it's going to be intimidating because you will lose patience. Okay? But think about it for a minute before I move on with this interview. Think about that you at some point right now, and I get why in the beginning, are allowing yourself to receive less than your actual fee. When you created that fee, did you make it like way higher than it should be? You didn't do that. You made it. You sat down at one point with your crown and the things that you do the most of. You probably asked what everybody else is charging. You assessed, which you should, your level of education and commitment to CE, which and I'm sure Sonny's exactly like me. It's a total lifetime commitment, especially if you're going to be fee for service. If you're going to be like everybody else, I guess it doesn't matter. But if you make a lifetime commitment to CE and it's a part of your budget, just like the rent, then you deserve to get the fee that you charge. It's just a fear thing. It's not an ethical thing or a thing about integrity. It's a fear thing. So you got to remember one thing. At the end of the day, remember this. This career is going to go faster than you want it to. I'm telling you, I'm going to be 70 this summer. And most of my colleagues have retired. And I don't know how. And I was cognizant of time. And I still didn't help me. It still didn't. I don't know. It just went too fast. And you don't want to wake up your last 4 years when you're fearless because you're going out in 4 years and then do it right. Make a plan early on in the first 5 years and make your move. And if you are good, you don't have to be Frank Spear and John Coyce. You just have to be the best version of you that you can be. And that'll work.
Great customer service.
Great customer service.
And I mean, on our podcast, we talk to so many people that have that. And there's one guy that we're actually doing a series. We talked about before 6 months before he dropped it, when he dropped, and it was his last plan, and it's 50% of his patient base.
So
50% of his patient base are in this one insurance plan. So how
yeah,
did he do
tell
it?
us how he did it.
Did he talk to the people?
Yeah.
Did he send a note? How did he prep? And now we're 5 months after
Okay.
the fact. So we've had 3 parts. It's been great. There's been a lot of other people that they talk about dropping the insurance, and 100% right, Steve. You're 100% right on the lack of a plan. And the first thing you got to do is you got to have the mindset. Once you decide you're going to do it, you have to have a burn the boats mentality.
Say
You have
burn
to
the
say,
boats mentality.
"Oh,
Go ahead.
and I'm not going back." Yeah.
Yeah.
I'm going to burn the boats. I'm not going back. There's no way
I mean,
out.
I'm sure there's somebody, Sonny, out there somewhere that went back. I don't know of anybody. I don't know of one clinician that's in my scope of friendships that ever said to me, yeah, I tried it. Think about this, guys, because this could be true of a lot of things. Like me with ortho. I tried ortho. It's just not my thing. I went back. Okay. I referred out.
You got to see. If you're not seeing his facial expression, you're missing it, folks.
They're seeing it. There's a camera on me.
I'm seeing it, man. It's great.
You know, but I don't know one clinician ever in my history of as a dentist that said, yeah, I tried it. It wasn't good. I went back. Insurance is better. You're never, ever going to, that's never going to happen. I'm telling you, it's not. So you get a plan and you should be with like-minded people. I'm telling you to listen to his podcast, to hear other people. Mine's not dedicated towards that. And there'll be a lot of stories, of people that I'm sure everybody's scared in the beginning of that.
Yep.
None of your patients are going to call you up the day they get their notice, or whether it's a phone call, or I'm going to ask you about that, Sonny, in a second, and say, that I've been waiting for this. Yes, now I can pay more out of my pocket. No, that's never happened. It's not going to happen to you. It doesn't have to happen. What has to happen is that the people that value your organization. Let me tell you what happened today real quick. I had a patient in yesterday. We're talking, by the way, 82 years old. Low maintenance man. I extracted 8, 9, 23, and 24, added it to his existing partial. Okay? You need to be clear that just because you're fee-for-service practice, and I'm sure this is true of you, Sonny, I don't have a full mouth rehabs on everybody. I have cases that are, the case is what it is. You've heard me say that.
Yep.
What it is determined by what the patient's motivation and chief complaints and restorative desires are. It's determined by what I see when I look in their mouth and examine them with a comprehensive examination. And of course, it's certainly governed by their budget. Of course, that's true. And so I do a couple all-ons a month. I don't have a special marketing team for that. It is what it is, like I just said, but this guy, his partials fit very well. He did not have it in his budget to do endo and crown and bridge certainly on 8, 9 that I had diagnosed with recurrent decay, which, by the way, I diagnosed over a year ago. They were asymptomatic. He came in for hygiene recently. And I said, look, would you make a move for me? And that's how I talk to patients. Would you do something? If the something is just add it to your partial and remove them, then do it. You still have enough teeth to support this partial. Anyway, he came back today to have the repaired partial put back in. And I'm in the middle of a heavy clinical day today. And I look and it's 2:30 and he was due at 2. And we weren't even that busy. I certainly was, but as an office, we weren't jamming. And I went out to my front desk and said, listen, and that's why I'm telling you the story. I said, part of being who we are is not letting an 82-year-old guy sit in my waiting room 35 minutes when he doesn't have to. We had rooms back there. We could have brought him back. You're part of this I'm talking about my front desk. You're part of this journey for all of us. to make us desirable for people to come to us was being on time. It's not me in back clinic. It's you. I need you to pick it up. By the way, this wasn't the first time I had that conversation. You know, I didn't yell, but I was as stern as I was just now in this camera. So you have to do that.
Good. What time is your first patient in
9.
the morning? What time? What time do you get to the office?
I used to get to the office 5 after 9. But this is a true story. You know, and I'm telling you something.
You're killing me from my point. You're killing me, but go ahead.
43 years is a long time to be in practice. And you go through all kinds of different things. I used to go 2 hours before. It's very easy when things are going good. And I would not take this as advice from me. It's easy when things are really rolling to put in an automatic pilot. The second I stepped away, a lot of things, when I say stepped away, I mean stop paying critical attention to everything. For goodness sakes, I found out, there's a lot of gems in this podcast. I found out that my office stopped doing morning meetings. They told me they did them, but they kind of did them, and that's not a meeting. And so about a year ago, I returned to the morning meeting. I'm there 30 minutes before. That's what. Yeah.
Everything matters or nothing matters, right? Didn't you say that to me in my podcast?
Yes, I did. Everything matters or nothing matters. In fact, in the protocol book I wrote,
that's a quote.
I wrote a book 20 years ago, and it was called The Hour Before You Start Protocol. The Hour Before You Start Protocol. Now, I wrote that book. I feel like I'm interviewing myself, so I got to shut up. But I wrote that book because I had too many ups and downs. Like, we would be great for 3 days, and then we stunk on Thursday. Or the clinic would be good for a month, and the front desk would drop balls, vice versa. And so in that time, I decided I got to get to the office an hour before. You know why? Because when you run 4 offices like Sonny does, 5, excuse me, I've got 2. It requires a lot of stuff that you have to answer, pay attention to, that's got nothing to do with productivity, of you producing productivity you'll get paid for, right? What do you do? What do you recommend?
It goes back to everything matters.
Everything matters.
Yeah.
You know, a referral to your, in my case, an orthodontist or endodontist. I don't do any endo either. You know, calling a patient back for something that happened this morning. Getting all the things done, getting labs off, whatever it is, right? That's I used to have a protocol. I do have a protocol. The hour before you start. And you know what? It's just like when you, right, Sonny? It's like when you take off early to go somewhere, you never hit bad traffic. It's always when you're running late.
Always.
Yeah. So tell me this next gem I want to know about. I know how I do it with 2 offices. You know, the fee-for-service thing, embracing quality care, quality customer, patient service. I know how I do it. I don't think I would know how to do it if I had 3 offices, let alone 5. So how do you manage that?
You could do it. I'm going to tell you that right now. I just know you. You could do it. Well, you absolutely got to have a great team, right? You got to have the right parts in place. I have great docs that are all unique in their own way, but I think all share the same philosophy and core values that we have. And you know, the customer and the service end and everything you can do for the patient, you can do. And there's not really a question. And it's just boils down to, if that's your mother, that's your son, that's your daughter, whatever walks in the door, how do you treat them? And that's just the basis of everything we do. Then it's a matter of trying to have everybody on the same page. Is such a cliche, but at least everybody rowing in the same direction.
Do you have morning meetings at all your 4 or 5 offices? Do you do that?
We do. But it's each doctor's responsibility, you know? So if I'm if I work the afternoon 1 to 5 or 1 to 7, I probably hadn't had a meeting. The meeting was taken care of in the morning.
Yeah, right.
So I'm the morning guy. So I start my patient's pace. I see my patients starting at 7 a.m. So I'm there pretty early, but we're having that meeting at 6:35 on the dot.
Really?
I'm standing there, let's go, and they're ready. And occasionally someone walks in and they haven't clocked in or they have their coat on, whatever. But we're there at 6:35 and we're going to review the day. And I've already pretty much memorized everything I've got in front of me, so I can look at that little schedule and say, okay, now this patient, that patient, and here's some things and some subtle things, and everybody has some great input too as to where it fits. Um, that's an important factor in the whole way that it runs, but the only way to run it together, all five together, is you have to treat it as a one unit entity. Even though we're four separate business entities, we are one organization. So that means unfortunately, we got to have meetings here and meetings there.
How often do you do that?
We got to have.
How often you meet?
Well, we break it down. Like we meet every 2 months, key administrative staff, and all the doctors. Can't remember the last time all the doctors attended, but they're all supposed to be there. Generally, life gets in the way, but I'm always there. My main partner is always there. And the other docs are usually there, one or two, but I don't know last time we had all seven. We usually have about 4 of the 7. And then we'll have a report from our lab. They'll talk about how many units, remakes, redesigns, anything they're seeing in flow. Okay. We'll have a person, our accountant in-house, CFO. He'll talk about that. Our office manager is new to us in the last 3 or 4 months, so she's just getting comfortable. But we'll have our office managers from each location talk about different things that may have encountered, or different projects that they're in charge of. Our membership plan, our change that we're going to do for reservations for appointments. How are we going to handle that? If we're changing our procurements or buying or purchasing of products, the inventory controls is a thing that we're starting to look a little bit closer at. It's just some of the little things that fall under the everything category that are, I don't know, some of them are just nuisance things, but if you don't pay attention to the small things, right, then they become big things, and the devil's in the details.
Let me ask you this, so when you just spoke to me, I heard you work today, correct or not?
Yeah,
okay,
yeah,
work today. Did you do the morning meeting today?
Yeah,
you did. So you hear?
Yep.
I asked them that on purpose because how long have you been practicing? How many years?
35.
So those of you that are out there for 5 years, 10 years, it's 35 years he's been practicing, and he was at his morning meeting at 6:35 this morning because
I was in the office at 5:30.
Okay, now you're getting on my nerves.
I got there a little late.
Wow. What time you go to bed?
There was an eclipse that bothered me. I couldn't get there till 5:30.
Well, listen. My point is this. I remember I big time myself, I think. I told you I get in at 9:05. There was times I came in at 9:20 because I knew they would be numbed, right? I knew they'd be all ready for me. And I was, at that point, well, it's still not like that, to be honest with you. We'd be doing surgery, and I was really prepared for exactly who was in that day. I knew what I was doing on every single patient. So nothing was a surprise to me. But things happen. That's why you have to have a morning meeting. I mean, somebody's going to call your office, are they not, guys? Mm-hmm. Tomorrow or Monday. That's not on that schedule right now. And that's something that you have to have a strong system for. Because how do you handle?
Yeah, when I leave, I'm not spending time looking at the schedule today or tomorrow. I'm done. I'm home. Now I'm like, tonight I'm going to go. I got a baseball team I'm helping coach. So I'm going to go there.
Yeah. So let me close with a couple of things. There's not a dentist listening that staff is not an issue. And you may not have the answer to this, by the way. Staff has become an epidemic issue for not just dentistry, but just about any dentist I know says to me, "What's going on? You've had the same issues?" And I only have the two offices, of course. By the way, I lost somebody yesterday. And they didn't quit.
I lost 2 yesterday.
Well, there you go. We're the leaders in dentistry, and we're losing people, just like you lose people. And it happens to all of us. What are you doing about A, trying to minimize that? I know what I'm doing. And B, what are you doing to find people? Because likely you have to look more than we do with staffing 70 people.
It's been the biggest challenge that I can remember in my 35 years. I don't ever remember anything like this. Right. We have a hygiene school in our area. We used to be pretty flush with that aspect in dentistry, and dental assistants, we pretty much hire personality and train technical. And we still do that. And we've been pretty successful on the assistant front. The business admin, been very hard for consistency. We started a call center. We call it our care team. Very hard to keep people employed in that arena for one reason or another.
Well, where do you find
the
people? Like, you go to Indeed? Do you?
We've used Indeed a little bit. We've used some local stuff. We actually told our team if they refer an employee to us and they stay a certain amount of time, they get $1,000.
So did you hear what you just said?
That's resulted in some solid employees, no question about it. Right. My one assistant, Paige, she came. Heather's in our lab. They work together. They waitress, and she's dynamite, just dynamite. And there's been a couple of other, Kate, our hygienist, and probably our biggest issue every year is pregnancies. We are at least an average of 3 to 4 pregnancies every year.
Yeah.
I don't know if it's something in the water. It might be something in the room sterilizations, wipe downs. That might be.
I hear you, man.
Bottle that and sell it.
It's been an issue that, as I said, resonates to every dentist that I know right now, and it seems to be since COVID for us. I want to tell you one more thing, guys, because I didn't know what he was going to say. He says he goes to his staff. That's exactly what I do. I go to my team because I know I love my team. So I want and I need to say one more thing, and I'm going to let you go because I need to get a baseball thing.
I got 10 minutes.
Okay, good. This interesting thing happened to me. I have been so frustrated, and my team watches this podcast, not all of them, from time to time, but I don't say anything I wouldn't say to anybody's face. It's been frustrating for me because I do have a lot of new faces in and out. Not my core people, but people, I have 18 people that work for me. At a height, it can be like 22. So 4 to 5 people seem to be coming in and leaving, and I can't nail them down. So I do go to the core people and say, you must know people in the industry that are like-minded, or if it's an admin that they don't need a license, that are just friends like you, people that you hang out with that are like you.
Right.
And I have struggled so hard with teaching. It's really hard to dip back in and teach a young dental assistant the way I like, because I'm very strict about how I do procedures. And I got to tell you, this week I felt, and I hope maybe I'll tell you a different tune 2 weeks from now, but it felt like it finally paid off for me, because my master assistant, the assistant had been with me for 35 years, retired last year. I talked her into staying 1 day a week, but it's had an effect. So everybody below her had to step up their game, trying at a crown for me, doing contacts, getting everything done till I can walk in, cement the crown, and be done. Right? It has been painful to get to that point, but I watched it this week. It's very much like you're going to coach a baseball team right now? Mm-hmm. How old are they?
Baseball. This JV, so they're 13, 14, 15, couple 13-year-olds.
So it must be a little magical when you finally watch that 13, 14, 15-year-old team beat a team that's probably better on paper, but they learned what you taught. That's how it felt this week. My team beat the odds. We were good this week. And I didn't have my the A team that I had for so many years.
Didn't have your A team.
They were big, and I told. So here's one more caveat. I tell them a lot. I don't tell them. I don't blow smoke. If they're not good, like I told you my front desk today, I don't let it go to tomorrow. I deal with it today, and when they're good, I'm all over it, man. I was all over it this week. Like, what did you guys drink this weekend? This is the best I've seen you execute, perform. I couldn't be happier. I mean, and I even text them. I told one of them I loved them.
Yep.
I was so happy with it.
Yeah, it's true though. I mean, I'm glad you used that word because it's true. I love my team. I love them. And it takes something to say that and not worry about sexual harassment or whatever, but it's visceral and it's authentic.
Yeah.
And it's sincere.
Yeah, I text.
I'm not blowing smoke. I'm not blowing smoke.
No.
I'm not going to say, listen, that was a great right over left step down the hallway. No. You did a great job with that patient who had high anxiety just by staying in the room. You calmed them.
That's
you
great,
have no idea
Sonny.
how good you
That's
did.
better said.
Just like that.
That's good stuff, man.
Right?
Yes.
Yeah.
So 2 things left. One is, I asked this last week to Dr. Picos, and I'll ask you too. Although you started so early, I don't know what you would say. My question is, what would you tell a younger version of yourself or wish you had now that you have 35 years in dentistry or in life? Anything resonate? Anything jump out?
Well, I think the commitment to education and constant improvement, the acceptance of change as a fact of life, and basically a change, adapt or die, whatever that saying is, right? I think that's ultimately important, but you don't change for change's sake. And always have that big vision in mind, that where you want to be, just like you talked about people dropping in 5 years and stuff like that. I think you always have to look at the forest. We get so hung up on the trees and the minutia of running a practice or administering a practice that sometimes we forget to look at the big picture, like who we are. Where do we stand in our community? Are we doing enough good deeds and good community service? Are we out where we are supposed to be in front of other things? Like, we do a free day of dental care called Doctors with a Heart. We've done it for 28 years. We've done over $1.5 million worth of free dental care in that time. And there's an office that's a big, huge clinic setting, and they've got multiple offices. Well, they've been doing it for about 10 years. I couldn't be happier. The more the merrier. I'm glad people are finding. We have community scholarships. Orthodontist in town has it now, and some other things. I couldn't be happier. That's a positive effect that I think we, as leaders, hopefully in our communities, are doing those things and helping that get started. So to me, I'd look back and I would just reinforce, look big picture, always start there. And then the devil in the details, and never forget you put everything into it. So when you go home at night, you're proud of what you did, even though everything's not going to work.
Sure.
And have that mentor that you can talk to, that relationship, that person you admire, respect. Like when you have that patient, and let's say your patient that needed all those crowns and was financially strapped, ripped into you in a certain way, and you're like, oh, I feel terrible, and you feel like you're lesser. You need to have that conversation, probably with someone. I've been there and done that, like my associate yesterday was doing a full denture on the lower against the natural upper. And I was like, I was taught not to do that in my dental school. Now, if you're not having implants, this is going to be a nightmare for you.
Yes.
I suggest you spend a long time discussing all the troubles and difficulties and challenges that are going to lie ahead. So it's not, you didn't tell her after the fact. You told her up front before those other 5 teeth are extracted. Just have that conversation. And I'm hoping that I'm helping her avoid some troubles later. So trying to be a good mentor and a good teacher to her.
Where would my listeners find what's the best? It's called the Fee for Service Dental Podcast.
Yeah, Fee for Service Dentist podcast.
Dentist podcast, Fee for Service Dentist podcast.
Spotify, iTunes, wherever you get podcasts.
Uh,
It's on YouTube now too.
Okay.
Facebook page is the Fee for Service Dentist podcast. Now, if you want me personally, it's just Sonny Spera.
Which is the one where you put off all those nice sayings every morning?
Yeah, that's on my personal page.
Sonny Spera.
Every day.
Yeah.
You know how that started? My basketball team, my girls' basketball team that I coached, I was a varsity coach for 9 years. I started having them, started out doing a quote per game. And then I started getting them to come up with quotes. So your job, you got to come up with a quote. Then I started bringing them every day, and I had a book of quotes. And then I would stop, and I would say at the end of practice, what was today's quote? What did it mean? And it resonated. To this day, they still talk about some of those things. So I said, you know what? Why the hell am I not doing this in my office? Yeah. And then I was like, well, I should put this on my Facebook thing. So every day I have some saying, and boy, one day I got it on there like 1 o'clock. I had 4 people like, hey, what happened?
People count
you forget
on you,
it?
Man. You're like a preacher.
Oh, they're on me. They're on me like, you know what, man? I was like, oh, shoot.
Well, listen, Sonny, I've only known you for a few years, but you can trust me when I say this. To know him is to love him. He's just that kind of guy. And I am so happy our professional paths crossed, and still haven't met you personally, but that'll happen, I'm sure. I thank you for your time, and you bring some value, big value and credit to this podcast, and maybe we'll do it again one day.
Appreciate it. Can I tell everybody the fact you don't even remember it?
Okay.
I wrote my very first and only full article for Dentistry Today, the big one. And it was about, believe it or not, it was about DSOs, Sally McKenzie, American Dental Partners. I was at Kit Weathers' course doing endo, and they came and they gave this presentation, and I was just appalled at what I saw and how it was handled. And I wrote it, and you personally, Stephen Rasner, called my little tiny office in Conklin, New York, and you said, hey, man, that was a great article. And I was like, wait a second. This is the dude that's on the cover of the magazine. He's got a color picture. He writes, he lectures. This is big time. He's calling my little ass in Conklin, New York. I swear to you, I was over the moon that I got that phone call. And when you asked me to be on the podcast, it was almost the same thing. I was like, oh, this is pretty cool.
Well, you know me now, and I never look at myself. A lot of people treat me like I'm on the cover of magazines every week, and I'll take it. Keep treating me that way, because I'm my hardest critic, and I can use all the positive affirmation I can. And I've made a lot of good friends, and I certainly include you, Sonny. So love you, man. Thanks for being part of it.
Love you too. You made a huge impact, and you still do. Thank you.
Well, everyone, another episode of the Lionhearted Dental Podcast. To my listeners, thank you for tuning in. And remember, the heart of a lion lies within each of us. It's courage, strength, and the purpose that defines us. Stay lion-hearted, and we'll see you in the next episode.